I work in the legal industry. I'm a lawyer. I've dealt with depression and anxiety for many years. Around 4 years ago, when I made a change in my career, change in my job, I definitely noticed that I was getting angrier and angrier. I wasn't getting angry at people, it was more situational. It made me think that I needed to look at making a change in my job or in something, right? And so it wasn't that long after that where I was just very fortunate I was able to switch roles within the organization where I work, and it was a godsend, right? It really, really made a big difference in my life. There were significant impacts, I believe. I was exposed to a lot of very dark subject matter on a constant daily basis, and I would have to look at files that involved violence being perpetrated on people, on children. Realized I couldn't do it any longer. I had to make a change. If there was stress increasing at work, sure, it spilled over into my life at home. Like I'd come home and I'd take it out on my wife, whether it was just being impatient, angry, and if things were stressful at home, so if I wasn't doing well mentally and there was stress in our relationship, certainly that spilled over into the workplace. The position I've been in for the last 4 years, it's definitely had a positive impact. It certainly has helped my work-life balance because I have much more regular hours. I don't have to work many weekends or long into the evening, so I'm just at work less, so I have more time to be at home or more time to do other things, whether it's hobbies or socialize, proactive, pro-social activities. And the organization I work with certainly has its stresses, financial and staffing and otherwise, but as a group, we're so tight and very supportive. It's also helped that in the last 2 years, we now have a peer support program in our workplace, which has been huge. I'm a peer supporter, so that's been great for me because it helps me get out of my head, right? So I'm not focused all the time on me. There's people that approach me and have their own issues, and it forces me to focus on active listening, on empathy, and really focus on the other person, right? And just see what I can do to be supportive for them. It's not about counseling or it's not therapeutic, it's really about listening. If they say something, it's going to be held in confidence, that it won't impact their role at work, their job, and providing people with resources because our organization is very large and there are there's an employee and family assistance program, but unfortunately not very many people know very much about it. If they have a mental health issue, they just look around and they go, they think, well, I can't talk about this in the workplace. And maybe they can't feel they can't talk about it at home either. So they isolate and they don't get the help they need. I'm willing to bet there's always at least one person that you can go to. That first step is the hardest. I know for me, like picking up that phone to get help, that was difficult because it made it very real in that moment. But once I did that, it was much easier after that. Just really looking forward to this year's conference and just hearing from great speakers and just hearing about more of the good work that's being done in workplace mental health.